Hello, my name's Magnus and I'm the Chief Medical Officer at Leeds Teaching Hospitals. Every year we have an absolute privilege in supporting 9,000 births across our maternity units and caring for more than 1,600 newborns in our neonatal services, many of whom need intensive care or surgery. It's a responsibility we hold with great respect and commitment. Over the past year we've faced some difficult challenges. The Care Quality Commission reports earlier this year highlighted areas where we need to do much better. NHS England's Maternity Safety Support Programme team also made recommendations for improvements. And most importantly, we heard directly from families who shared experiences fall short of the standards we strive for. To those families, we are truly sorry. We now have a real opportunity to look at our services with fresh eyes and renewed determination. With the support of external partners, we've developed a comprehensive improvement plan and it's already making a difference.
My name's Ruqayya Mia. I'm the Director of Midwifery and Deputy Chief Nurse at Leeds Teaching Hospitals. We know that pregnancy, birth and the early days of parenthood are some of the most important moments in life. Families place enormous trust in us during these times, and we are committed to providing care that is safe, inclusive, compassionate and of the highest quality. Since autumn 2024, we welcomed 55 new midwives to our teams, and between September to the end of this year, more than 60 midwives are joining us. We have also recruited 25 neonatal nurses to strengthen our services in the care of our babies. We are creating more space for staff to speak up through regular meetings, open forums and listening sessions with senior leaders. The voices of our staff are vital to shaping the care we provide. We also have established a new Maternity and Neonatal Improvement Programme Board, independently chaired by Bertie Harlov-Lamb, OBE, who is a nationally respected leader in maternity and neonatal care. Her guidance will help ensure our services are meaningful and lasting. But perhaps most importantly, we're committed to really listening to our families. Their experiences, concerns and hopes are at the heart of everything we do. We want every family to feel safe, respected and supported from the very first moment of care.
Hi, I'm Gemma. I'm one of the preterm birth specialist midwives in Leeds. I've been a midwife in Leeds for the last 23 years and I adore my job. Currently, I work looking after women that are at high risk of having early babies and also women that have actually had early babies in this current pregnancy. It's a really rewarding role and we absolutely love our job. I want to play my role in improving our maternity services for the women in our local area, and I'm really looking forward to working with the new midwives that are going to be joining the trust. New equipment, in addition to new staff, will help us to do our jobs more effectively and will help us to provide better care to the women in our Leeds and the surrounding areas. We want all of the families that access care in Leeds to have the best possible experience. It's really important to us as staff that that is at the centre of the care that we give, and we're all really determined to make that happen. Together with my colleagues, I welcome the National Maternity Investigation. It'll be good to get fresh eyes on the service again and to highlight the changes that we need to make. The last year has been incredibly hard for midwives working at Leeds. We've been under increasing scrutiny and nationally maternity services are really under the spotlight. But it's providing an opportunity to improve the services that we all provide, to make sustainable changes, to make sure that we are giving the best care to the women in this country, not just in Leeds. And that's at the heart of the care that we give, and that's what we're all passionate about.
Hi, I'm Hannah. I'm a staff nurse here on L43, the neonatal unit at Leeds Teaching Hospital. Here on the unit we look after the sickest babies, providing most professional care, but it's not just the babies from Leeds area, it's from all over the region, Yorkshire and further afield, because we are so specialised. A lot of the babies come to us for that complex specialist care. It has been very difficult hearing the criticism of our service, but I am glad to work with such a supportive team that are helping us get us all through this time. We are working our way through the recommendations that have been put in the report, and I myself have seen some improvements already on the neonatal unit. We are determined to keep on improving so we can give the best possible care to all the babies and their families.
We're confident that the steps we're taking will lead to the kind of care every family deserves. Safe, high quality and compassionate care. We know there's work to do and we're doing it. We're listening, learning and acting. And we're committed to making sure every family who comes through our doors feels safe, every family feels respected and every family feels cared for. We're here for those families and we're moving forward together.